Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
It's Wednesday. That means it's Wellness Wednesday. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. We are actually launching their 4-part docuseries today entitled Preventing Diabetes, examining how South Carolinians and prevent and manage diabetes and prediabetes. We'll talk about the event debuting tonight and DAC's 5-year comprehensive diabetes prevention plan, plus their FACES campaign. That is coming up next, and we're going to talk about it with Kanisha Golden-Smith, Diabetes Action Council of South Carolina, Michelle Harris, who is Communications and Resource Coordinator for the Division of Diabetes and Heart Disease Management at DHEC, and veteran broadcast journalist Jack Kinsey. Thank you all so much for joining us today. We appreciate it.
Thank you for having us.
Great to be here.
Thanks for having us.
Absolutely. Look forward to a great conversation. That's coming up next and more on Coping with COVID. But first, your COVID community updates. Well, Columbia has a new mayor this morning. Daniel Rickerman won the runoff election yesterday against Tamika Isaac Devine with less than 800 votes between the two. It's the first time in over 50 years that the city of Columbia has been led by a Republican. Meanwhile, political newcomer Aditi Bustles won the at-large seat against Tyler Bailey. Now, the State Election Commission has ordered a hand count of the vote, which will happen today. This was decided due to reported problems at several polls, which caused people to have to use paper instead of electronic votes. The new mayor and council members will be sworn in on January 4th. Funeral arrangements have been announced for the oldest and what some have said the most powerful state lawmaker. Funeral services for Senator Hugh Leatherman will be 3 p.m. this Friday at the Performing Arts Center in Florence. We reported last week that the 90-year-old passed away last Friday after entering hospice following a cancer diagnosis. He represented the Florence area in the Senate for over 40 years. Meanwhile, a special election to fill Hugh Leatherman's seat will be held in January. Those interested in the position can file to run between December 3rd and the 11th. SCDHEC has the most up-to-date list of times, dates, and locations for COVID testing, COVID vaccinations, and flu tests in and around South Carolina. Visit scdhec.gov for more information. Now, if you are a veteran in need of COVID vaccination, the VA is handling all vaccinations for veterans. Contact the VA for more information. Also, several retailers, including Kroger Pharmacies, are offering COVID vaccinations. Check the screen for details. CVS is also offering vaccinations at their standalone locations and also those locations in Target stores. Brooklyn Baptist Church is part of the Lexington Medical Center vaccination clinic, and they are open 7 days a week. Now, all of these vaccination clinics that we listed are also doing the children's COVID vaccine. The public library in Richland County, all of those locations are actually administering and giving out free self-collection kits for COVID. You can stop by any of the Richland County libraries on the screen, and you can pick up at least 5 kits per week. Again, these are kits that you can give yourself a test and mail it in to get the results. If you are having some challenges finding a ride to get your COVID vaccination, don't miss your shot. The Comet Bus System is giving away free rides to get your vaccination via the Comet. Now, if you or someone you know is having some challenges making your COVID vaccination, Get Set Up is helping seniors and others make their COVID vaccination. Now, they won't make it for you, but they will certainly help you to learn how to make your COVID vaccination. Your appointment for your COVID vaccination, you can see the screen for more information. Several financial resources are available. FEMA is still giving out reimbursements for COVID funeral expenses. If you lost a loved one due to COVID, please contact FEMA so you can inquire about getting your funeral services expenses reimbursed. The South Carolina Bar Association and SC Legal Services have a free toll-free number and website for rental and mortgage help. Lexington County has a bill assistance program. Also, SC Housing and Dominion Energy has a assistance program for rent and utilities. SC Housing has a frontline workers home buying assistance program. And SC Hopes has a 24-hour assistance line from the South Carolina Department of Mental Health. If you are having some challenges coping with COVID, please contact the folks at SC Hopes. Coping with COVID and In It Together present Wellness Wednesday every Wednesday from the Diabetes Action Council of South Carolina. We are actually streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. Not only will you be able to watch Wellness Wednesday on Wednesdays, they have got such great resources on that In It Together Facebook page. So go over there and check it out. We're also streaming live on the Tailor Production Facebook page. That is the home of Coping with COVID. Again, please go over there, hit the like and share and follow. You'll also receive notifications when to watch Coping with COVID Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time. And also first Monday with comedian George Wallace. Go over there and check it out. We're also streaming live on YouTube. Want to say hi to all of you YouTubers. Thank you so much for joining us. And please don't forget to hit the subscribe button. Now, also, we are a live show, so if you have a question or a comment, please post it in the chat and we will get it on for you and answer your question as best we know how. Also, throughout the show, you will see a scroll at the bottom of the screen. It's got several of the resources that I mentioned just a few moments ago, and also other information that you need to know, not only today about diabetes and diabetes prevention programs, but about COVID testing, COVID vaccinations, financial resources, and more. Great information being shown on the scroll. So please continue to post and share this message out because, as we say, we want to get the message to the masses. In It Together SC and the Diabetes Action Council of South Carolina will launch a 4-part docuseries today entitled Preventing Diabetes, a look at how South Carolina can and does manage and prevent diabetes and pre-diabetes. The online event takes place at 6:30 this evening, and you can view it on the In It Together Facebook page and YouTube pages. We are actually talking about it today with Kanisha Golden-Smith. She's with the Diabetes Action Council of South Carolina. Michelle Harris is Communications and Resource Coordinator for the Division of Diabetes and Heart Disease Management at DHEC. And veteran broadcaster Jack Kinsey joins us. Also, thank you guys so much for joining us today on Wellness Wednesday.
Glad to be here.
Yes,
my pleasure.
Well, thank you so much. Kanisha, I want to ask you about this statewide diabetes prevention plan. We're going to discuss that a little bit later on. But why did DAC decide on a docuseries to inform South Carolinians about what's happening with diabetes in South Carolina?
Okay, well, that's a great question. So the docuseries decided on it because it's going to illustrate the impact of diabetes in the state of South Carolina among vulnerable populations and the efforts that are being made to delay, prevent, and manage type 2 diabetes in the state.
Yeah. Michelle, as a former broadcaster, did you think this was an innovative way to show the impact of diabetes on in the state?
Well, it really was, Trey, because a couple of things. As you know, oftentimes we don't have enough time to tell the full story.
Yeah.
And so bringing together broadcasters like Jack Kinsey, storytellers, expert storytellers, to really take a 360 view of what diabetes and pre-diabetes, diabetes prevention, diabetes management, how all of these things are affecting real people's lives. I thought that was a tremendous opportunity for us to give people a glimpse of what it really is like to walk in, a day in the life of, but also the innovative part of it is, again, digital is the way that people were connecting through COVID. So now we have all of these platforms that we can share this on. So we're not bound by geography. We're not bound, really you can look at it on your cell phone. So yeah, this was a tremendous opportunity for us to share this message.
Yeah. Jack, Michelle mentioned that you are a great storyteller and she wanted to bring together storytellers, and you have won many awards for being a great storyteller. Tell us what your approach was to making this docuseries interesting and engaging.
Well, my first involvement with this project came through somebody that you all know, Carolyn Sawyer, my former colleague at WIS in Columbia, who approached me and asked me if I would be interested in taking part in this. And in particular, she was interested in having me take care of one of the segments that she had conceived. And that segment was to explore the impact of diabetes in rural areas and how it has sort of evolved into such a serious health problem in an era in which we have this contraction of healthcare in a rural area where we went, and in particular in Bamberg County, that area used to be served 10, 15 years ago by a couple of hospitals there that have since been shut down. Mm-hmm. As the healthcare system has continued to sort of consolidate in many places, especially in rural areas, and to literally get out of the business because it is such a difficult landscape to navigate now in terms of being able to maintain a cost structure that can keep those institutions going. So we chose Bamberg County in particular because there had been 2 hospitals within a reasonable distance from the people who lived there that had closed down within the last 10 to 12 years. And we wanted to see how that impacted the population there, especially the population that has to deal with this very pervasive problem of diabetes in South Carolina. As you all know, diabetes is one of the most serious health problems that South Carolina has faced over the years, and it has not gotten very much better. We still have more than 500,000 people who have been diagnosed in this state with diabetic conditions of one kind or another, type 1, type 2, pre-diabetes.
Yeah.
So it is a real problem for rural areas in particular because they do not have access to the kind of healthcare facilities that we have in urban areas and in places like Columbia, Greenville, and Charleston. It's a tough situation for those folks, and they are trying to meet a challenge there in a very difficult environment for healthcare right now.
Yeah, that's Jack Kinsey. He's a veteran broadcaster. He was one of the producers, storytellers, so to speak, in this docuseries that is actually launching tonight. And it is anybody in the public can actually check it out. We've got a link for you to check out the docuseries this evening at 6:30. And you can also view it on the In It Together Facebook page and also on YouTube. As a matter of fact, let's watch a little bit of the docuseries now.
Effects of diabetes because of genetic predisposition.
I've had grandparents, aunts, uncles, my brother and my son are diabetic.
Diabetes will tear your body apart.
It is definitely an epidemic, and it has been an epidemic for a long time.
Whether it be less access to health care, living in food deserts, reduced access to safe places to play and exercise, those are some of the risk factors for developing diabetes. The goal would be to help bring that A1C down. The history of injustice in this country contributed to inequities in healthcare as well.
Unfortunately, we are losing the war on diabetes, and we are having many casualties with patients suffering, with people losing their limbs, losing their eyesight, having kidney failure. Too many heart attacks and strokes that never needed to happen.
I was diagnosed with diabetes in 1999. I knew a little about diabetes because my mother was a diabetic.
This is a beatable disease. You can beat it, but we have to do it as a community together.
My mother told me that my old sister has diabetes. We were thinking, oh my God, it was difficult. We were thinking, now what?
I have a vested interest in seeing that we do everything we can to provide information and care for those individuals. I've lost family.
I think we lost some of the audio there for the docuseries, but we're going to try to cue that back up and play the rest of it because it was fascinating already. Just hearing some of the stories of people and how they're experiencing it and the diversity.
African American community and Hispanic community are particular.
Gotta love technology.
You gotta love it. You have to love it. You gotta love it. It's the reason for everything good and bad in the whole wide world. Exactly. Yeah. But I was saying that it's fascinating to see the diversity of the people. You know, I think sometimes in the African American community, we think it's just us that, you know, have diabetes. And yes, it's a lot of folks in the African American community, but actually one reason through this show and hopefully through this docuseries, people can recognize that anyone could have diabetes. Kanisha, what are the numbers and the demographics that diabetes affects?
Well, in South Carolina, about 540,000 people are estimated to have diabetes. And that's, you know, in the United States, about 34 million people have diabetes.
Wow.
So if you can look at those numbers and compare it. And actually 1 in 5 people don't even know they have diabetes. And if you go through the state's website and you're looking at some of the infographics, you'll see that diabetes is actually the 7th leading cause of death in the state of South Carolina.
Wow. That's Kanisha Golden-Smith. She's with DAC. Jack Kinsey joins us also. He was a contributor to the docuseries. Michelle Harris has also joined us. Michelle, why was this important for South Carolinians to see?
I'm glad that you mentioned that, because a couple of things come to mind. Number one, when Jack was talking about the piece that he did, and I'm saying this, I'm not saying this just because he's on here, I'm saying this because it's true, that his piece about the rural population really moved me to tears, because when he talks about the challenges that people have, the everyday challenges to accessing the supplies that they need, not only healthcare, but the supplies they need, the healthy food. We're an agricultural state. I think people think that, you know, oh, produce is readily available and everybody can have it and it's affordable. Not so. Safe places to exercise and get physical activity, just access to quality information.
Mm-hmm.
His piece showed, and you'll see, because all 4 parts will be played together, you're going to see that the things that seem to make us so different are really the same. They may manifest in different ways, whether it's rural or urban, whether I speak Spanish or English, or where I live in the state. It may look a little different, but the problem itself is actually the same. So it is so interesting for people to be able to see, as South Carolinians, this is a problem that we all face. Because guess what? Whether I have a diagnosis of prediabetes or diabetes or not, it still affects me as a taxpayer. It affects me as a member of the community. I guarantee you, between prediabetes and diabetes, it affects every family at some point, you know, every friend group, all of that. So it is so important for everybody to watch this docuseries, because we don't want to get it to the point where it's the leading cause of death, where 29203 as a zip code is the leading zip code in the nation for amputations and all of that. These are not, I mean, we want to be the tops of many things. These are not the list that we want to be the tops of. So this story about diabetes and prediabetes is really everybody's story in this state.
Yeah, that's so interesting you say that, Michelle, because I think we do forget, you know, when you live in, I mean, I'm in the city of Columbia, where it's not as rural as maybe in Effingham or, you know, in
Earhart.
Or someplace. Yeah, absolutely. And it's hard to believe and to conceive, if you're in a city and you have access to everything in 2021, that everybody doesn't have that. So I love that the docuseries puts it in your face. Everybody doesn't have what you have. And here's the other thing that I have to mention is, and Jack, you mentioned even access to broadband and internet. I mean, that's one thing that COVID really took the wool over people's eyes about, is that the availability of internet access. And these days and times, if you don't have access to the internet, you are cut off pretty much from the rest of the world. Jack, were you surprised in your reporting?
Well, here's one of the things that surprised me, and we sort of stumbled onto this just by accident. We shaped a good portion of our piece around the operations of a very small independent pharmacy in the town of Earhart, which has only a few hundred people now living in it, in Bamberg County. And that particular pharmacy is run by a woman named Donna Avant. She was a registered pharmacist. She bought this business some years ago and has been operating it. That is really the only access that people have to what we all take for granted here in the Lexington, Columbia area, and in some of the urban areas, and that is a pharmacy nearby that can fill prescriptions, can give you the medical supplies you need, can give you medical advice of varying degrees. And it just so happens that in particular, that in Earhart, that is the only pharmacy that they have in town now. And it happens that the Kaiser Health Foundation put out a piece that was just published in the Washington Post a few days ago about how rural America is losing its pharmacies. And this is sort of a case study in what's happening in rural areas. And that is, and I've got the article in front of me here, that corner pharmacies, independent pharmacies, not your CVS's and Walgreens, which rural areas don't generally have here, are absolutely disappearing from many parts of the country right now, and that is creating a health crisis in and of itself, because people who have been depending on these places to just get a prescription filled are now losing that resource as well. This story from Kaiser says that there are now 41 million Americans which are now living in what they are calling drugstore deserts, where you don't have access just to a drugstore or a pharmacist who can give you some advice on what to deal with, how to deal with your condition, or give you the supplies you might need. And that is a growing problem now. There are something like 12% of Americans that have no access whatsoever to even a pharmacy in the places that they live. And that is a trend that is very disturbing, and it has a lot to do with sort of this consolidation of the healthcare providers that I was talking about before, and the contraction of the options that people have had, that they've many places in big cities we take for granted, but out in the rural parts of the state, that is a serious health problem that has just begun to become even more exacerbated with the loss of not only the healthcare providers immediately in the community, like a community hospital, but also now the places that have sort of replaced those facilities as a resource for the local population to go and get something that might be life-sustaining.
Yeah. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday here on Coping with COVID. I'm Trey Taylor. We're joined by Kanisha Golden-Smith with the Diabetes Action Council. Michelle Harris is a Communications and Resource Coordinator for the Division of Diabetes and Heart Disease Management at DHEC, and a veteran broadcast journalist, Jack Kinsey, joins us. We're talking about the Docuseries that is launching today, Preventing Diabetes. Look at how South Carolinians can and do manage and prevent diabetes and pre-diabetes. The online event takes place 6:30 this evening, and you can view it on the In It Together Facebook page and on their YouTube pages. We're talking about it today, and some fascinating information about how important it is to see how other people are dealing with the disease that really affects us greatly here in South Carolina. And of course, as we know, it's just not, okay, I got diabetes. As Jack said, you have a condition and you may not even be able to treat your condition. Diagnose it. Let's start with diagnosis first, and then be able to treat it, because in 2021,
it's amazing.
We don't have access.
It almost sounds like third world conditions with certain things. And that's not an exaggeration. When it comes to, in Jack's piece, there were people who were traveling round trip more than 60 miles to access the education that was being shared at Earhart Pharmacy. And think about the price of gas right now. And if I have a limited income, if I have limited transportation, now my only source of credible information and education and outreach is a 60-mile round trip. There's some hard choices that a lot of people have to make. Again, you mentioned, Trey, about, why is it important for everybody to see it? Because think about me as an employer. If I have people who are on my payroll who have diabetes or prediabetes, they cannot access information, they cannot access care, they're having issues with different challenges. When it comes to that affects the output of my business.
Absolutely.
That affects the educational system. That affects it. So a lot of times I'm a little biased because I work in the division of diabetes and heart disease management, but you'll hear about breast cancer and you'll hear about all these other conditions and HIV, and God bless them. I'm not taking away from these conditions, but when we think about diabetes and prediabetes, it doesn't get nearly as much attention as it really deserves as a chronic condition, because
Right.
it really is so insidious. You mentioned it earlier. People go, oh yeah, okay, I have diabetes, or my family member, whatever, spouse has diabetes, and they're thinking it's a little touch of sugar. Well, it's not.
Right. Right. And you know what else I think it is? I think people think you have diabetes because you are making the wrong choices. Now, some of them are wrong choices, but some of it is hereditary. I never forget, and I've said this on the show before. I mean, I eat right, I exercise, but I still had a problem with pre-diabetes because it's in my family line. Not because I'm making the wrong choices. I'm out here sweating and exercising and drinking water and, not eating chocolate chip cookies and, but I could still have it, so
sure.
Yeah. And I think people think, oh, you're making the wrong choices, so they brush it off, as not being as important.
Yeah, and I think that's why we're working so hard to ensure that we're putting the resources out there, that we're putting the education out there for everyone to take a closer look at their health. Because like you said, you can do all those things right. You can work out, you can eat healthy, and then, you can still take an assessment test and see that you might have prediabetes. Exactly. So that's why we're pushing so hard for everyone to take a better look at their health, to make certain lifestyle changes, because diabetes is serious.
Yeah. Well, and you guys are doing a lot. And before we take the break, I do want to mention that you had an amazing event at the South Carolina State Fair. So I am so appreciative of all of the different resources. We're looking at some of the photos from the fair. And listen, the fair is such a major event in South Carolina where people come from everywhere. I had an opportunity to be out there, during that day, and saw so many people. And a lot of those people were from the rural areas. They were from rural South Carolina that came to the big city of Columbia to attend the South Carolina State Fair. So I really applaud the Diabetes Advisory Action Council, DAC, and also In It Together for initiating the outreach where people already are. I think it's one thing to expect people to come to you, but to go to where the people are is huge.
Well, Trey, thank you for joining us out there as well, and helping us publicize the fact that we had our first ever Diabetes Prevention Day at the South Carolina State Fair. And I know Kanisha was going to talk about it because Kanisha was out there too, but I was so pleased at the fact that we were able to partner with the State Fair, because the State Fair is an excellent platform. Everybody knows about it. And in the midst of, elephant ears and corn dogs and fried whatever, I don't even know what the fried thing was this year.
Fried everything.
Fried everything. Because the whole point is, again, meeting people where they are. You do not have to live a lifestyle where all you are eating is carrot sticks in order to make healthier choices. So people were very open and receptive to the fact that you can make some very small changes. Give yourself credit for what you are doing, because if you went to the fair, you got all your steps in that day. So there are lots of positive things that people can do, and you just build on those positive steps.
Yeah. Jack, did you want to jump in here? It looked like you had something to contribute to.
I was just going to mention here, this is sort of in a nutshell the kind of problem that a lot of people face that the rest of us who don't suffer from diabetes are completely oblivious to. I spoke to a woman at a supermarket in Bamberg during the production of this piece, and she talked about one of the challenges that she had was meeting the high cost of insulin. In fact, earlier this week on MSNBC on Morning Joe, they were having a discussion about this as being sort of an indicator of where we face these problems with the healthcare system right now. She had gone out of town. She went to the beach, I believe, and she had forgotten to take her insulin along with. She had to buy insulin from a local drugstore. It cost her $100 for a vial of insulin, one vial of insulin. But that is is actually a more reasonable cost when you consider. I ran some figures on the cost of insulin right now, depending upon what type you buy and how much quantity you buy at one time. You can easily spend 3 times that much, 4 times that much, more than $1,000 for insulin supplies right now. If you don't have insurance, that gives you a choice. You're either going to buy your insulin that may keep you alive or keep you from going into some kind of a coma, or you're going to make sacrifices elsewhere. And for some people, that comes down to a matter of, do I get insulin or am I going to put food on the table?
Right,
am I going to put gas in my car? Or am I going to get insulin? And that is an enormous problem that we have not solved yet. And we find time and time again that the pharmaceutical industries, that the middlemen involved in the healthcare system who are providing these products have not stepped up to find a way to provide that for people, that especially those who don't have insurance, who cannot cover the daily cost of something that keeps them alive.
Yeah. I mean, you're making a decision. Do I live or do I live or do I die? It's really, it's not even a life or death. It's, do I eat or do I take my insulin? That's death or death.
And this is a problem that has existed for years, and we have yet to adequately address it.
Yeah. Well, you know what, Jack? Unfortunately, the rich get richer and the poor get poorer. I mean, it's definitely,
especially now.
Yeah.
Well, the way that we address it, and I'm glad, Jack, that you brought that up, because you see already just from our discussion how many layers go into this. There's a lot of politics behind it. You have to follow the money. They're the big companies. They're the healthcare providers. But Kenesha can even talk to about the Diabetes Action Council of South Carolina is trying to bring together people who, employers, insurers, individuals, healthcare providers, who can talk about this issue and find some solutions.
Yeah. You were going to say something, Kenesha?
Yeah, I was going to agree, and that's what the Diabetes Action Council is all about. So we're made up of 40 plus stakeholders, all working together to ensure that everyone is aware of the education, management, and the prevention of diabetes. And that really focuses on provider engagement, the promotion of the prevention programs that we have to increase availability, participation, and a long-term sustainability of programs around the state.
Well, the launch of the 4-part docuseries is definitely part of that initiative, and the statewide comprehensive diabetes prevention plan for South Carolina coming up. We're going to talk about that and also talk about another initiative DAC has. It's called the Faces campaign, which debuts with former Miss America, Kimberly Aiken, who we see there. And we will, as we go into break, we will check out her commercial for the Diabetes Action Council and come right back with Jack Kinsey, Michelle Harris, and Kenesha Golden-Smith as we talk about the DAC docuseries launch tonight at 6:30. I'm Trey Taylor, and you're watching Coping with COVID Wellness Wednesday from the Diabetes Action Council and In It Together SC. We'll be right back.
Miss America, I know that taking care of yourself is important. Part of taking care of your health is knowing if you're at risk of type 2 diabetes. Prediabetes is serious and puts you at risk for developing type 2 diabetes. 90% of South Carolinians who have it don't know they have it. Visit inittogethersc.org. Take an online test to find out your risk and join a diabetes prevention program. Brought to you by the Diabetes Action Council of South Carolina.
Computers, they're a part of our everyday life, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
Let Palmetto Painting Services take the worry out of your next home painting project. We can paint anything. Our business is about interior painting and exterior painting. We offer services for residential and commercial properties. Restore the life to your home with a fresh coat of paint from Palmetto Painting Services. References are available upon request. Give us a call at 803-546-4570 today.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday here on Coping with COVID. I'm Trey Taylor. Thank you so much for joining us. We are actually streaming live on the In It Together Facebook page. Please go over there, hit like and share, and don't forget to post this information so we can get it to the masses. The In It Together Facebook page and website have such amazing information for diabetes and diabetes prevention programs, healthy eating and exercise tips, and so much more. So go over there and check it out. We're also streaming live on the Tailor Made Production page on Facebook. Please go over there also and hit like and share and follow so you can watch Coping with COVID Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time, and first Monday, Fun Day Monday with comedian George Wallace. We're also streaming live on YouTube. Please post and share this information out so we can get the message to the masses. And don't forget, scrolling at the bottom of the screen, we've got several resources available for financial resources, health resources for COVID, and more. In It Together SC and the Diabetes Action Council of South Carolina is launching their 4-part docuseries today. Preventing Diabetes is a look at how South Carolinians do and can manage and prevent diabetes and pre-diabetes. It's an online event tonight at 6:30, and you can view it on the In It Together Facebook and YouTube pages. It's actually part of a comprehensive statewide diabetes prevention plan that Daca says they are envisioning a state without diabetes. Wow. Kanisha Golden-Smith with Daca joins us along with Michelle Harris. She is our Communications and Resource Coordinator for the Division of Diabetes and Heart Disease Management at DHEC, and veteran broadcaster Jack Kinsey also worked on the project. He joins us also on Wellness Wednesday. Thank you guys for joining us again. So listen, Kanisha, I want to ask you, a state without diabetes, wow. Listen, I hope that's possible. How do we do that?
Well, I think it's possible. It is possible by all of us working together as one, because as we say, we are in it together, and that is very true, especially with we have this upcoming strategic plan. So doing a premiere tonight, we will announce the strategies for the 2021-2026 statewide comprehensive diabetes prevention and management plan for South Carolina. And the plan will focus on preventing, delaying, and management and treatment of pre-diabetes and type 2 diabetes. And in that plan, we'll have activities lined out that the DAC is going to work on to accomplish that goal. And for instance, in the first half of the show, we were talking about rural areas and how, in rural areas, we're missing diabetes prevention program and other resources to help people work towards the diabetes prevention and management. So for instance, in our plan, we have a goal or a strategy that's focused on increasing NDPP, which stands for the National Diabetes Prevention Program. And, it's a partnership for public and private organizations on working to prevent and delay type 2 diabetes. It's a year-long program, and it's a CDC evidence-based program that's really focused on healthy eating and physical activity.
Yeah. So it's a 5-year plan from 2021 to 2026. And you mentioned there are several strategies. You talked about one, kind of really focusing in on the rural areas. Can you talk about a couple of the other strategies?
Well, I'll talk about a few because they're going to be premiered tonight.
Yes. I don't want to give
this away. Another one of our strategies is focused on teaming up with employers. So earlier, Michelle mentioned that if she was an employer and she had employees with diabetes, it's hurting the bottom line, or because employees are not well, they can't perform their job. They're taking more sick days. So one of our strategies is focusing on connecting with employers and starting, programs through their wellness to focus on diabetes prevention, which is actually a good thing. Employers should work hard to ensure that their employees are healthy. healthy and well, because wellness is produce happy people produce great work.
Yes. Yeah, you've got to be conscientious about what's going on in your employees' lives, because that, as you say, and Michelle says, directly affects the bottom line, your bottom line. If your employees are sick, they're out of work. You know, if they're feeling bad, they're not producing effectively. So yeah, I love that. And of course, the docuseries does air tonight at 6:30 on the In It Together Facebook and YouTube pages. It is absolutely free for you to check out. So please stop by check out the In It Together website and Facebook pages and YouTube pages and check out the docuseries. And as Kanisha said, that 5-year strategic plan will be airing tonight at 6:30. It's a 4-part docuseries, and all 4 parts will air tonight. Veteran broadcaster Jack Kinsey was a contributor on that. And Jack, it sounds like you were really so engaged and enlightened in being able to just all of the information you were able to share and to learn. Why do you think this is important? And did you learn something that you didn't know?
I hope that every story I've ever done, I've learned something that I didn't know, and that's not a difficult task, really, because I don't know that much. That's one of the great things about journalism is every day you go out and you find something that you didn't know, and sometimes it gets you to the point where you think, if I don't know it, and I consider myself, a relatively engaged and aware person, then there's a lot of people who don't know that. One of the things that I was really heartened by in the production of our piece was that how much the community in a little town like Earhart has pulled together to try to make up for some of the shortcomings that sometimes rural life provides, and those are factors that are out of anyone's control. In this particular case, the pharmacist that I mentioned earlier, Donna Avant, has taken it on herself to do coaching sessions with people for free. They come in, she sits down with them, she tells them how to modify their lifestyles, modify their diets in order to mitigate some of the effects of their diabetic conditions. That can go to very basic things like, I talked to one fella who was in the habit of sitting down and eating a lot of really bad food, in one sitting. He would eat, a bucket of fried chicken, and he'd follow it up by eating out of a jar of peanut butter, and everything was fried. Everything was full of, saturated fats and things like that. That's the kind of thing that exacerbates the condition of diabetes tremendously. And simple changes in a lifestyle, getting more exercise, which is difficult sometimes in a rural area because you don't have a Planet Fitness right down the street. You don't have a place where you can go out necessarily and do laps around the track. So the community pulls together in many ways. They provide, they've taken it upon themselves to create sales of fresh food that, they truck it in from the farms or from for the grocery stores, and they get access to fresh food so they can eat fresh vegetables, and have that as an option instead of, eating white bread and Velveeta. That's not a good thing for anybody's condition, much less somebody who's suffering from a diabetic condition, but it's not always easy to find the solutions to those things. In this case, the communities in many cases have stepped up, and they have kind of gathered around each other and said, look, what can we do to help our own situations here that we can provide on our own, as opposed to waiting for a healthcare system to come in here and build a new hospital, which isn't going to happen probably these days. Or in the case of the town of Bamberg, in Bamberg County, they had a problem with a few grocery stores. One of the best grocery stores that they had in that town, in that city, had closed down, and there was an empty store there for well over a year until another grocery chain came in and located there, and then kind of revamped the whole environment for being able to purchase fresh fruit and vegetables and things like that would enhance the diets and enhance the wellness of the people around there. And it's a tremendous boost for that community. And it's, a lot of times it's the community itself trying to find the solutions to very difficult problems.
Yeah, I love that because that shows that there is still a sense of community among communities. People
Sure.
in those smaller communities are really conscientious about looking out for each other. And Donna seems to be, and I've met her, and she's lovely, and she's been on the show several times. And yeah, she's a champion in that community. And sometimes it just takes that one person, one or two people, to initiate a movement, so to speak, to care enough to bring other people along. So, I mean, I think that's encouraging for people in other communities. Michelle?
Well, I'm glad you mentioned that because Jack made some excellent points about the food deserts. Again, people do think we're in a rural agricultural state. There's fresh produce on every corner. Not so. There are plenty of places that are food deserts. The community filling in. One of the things that I thought was fantastic, and this is something else. Another reason why people need to reach out to Kenesha and become a part of DAC is because there is room at the table for everybody.
Yeah.
In Earhart, it happens to be a healthcare provider like Donna, who is so passionate that she is that champion. In a lot of places, it could be the faith community. Pastors play a huge role in convening people and pulling people together. They're credible sources of information. People listen to what the pastor says. So we are looking for more faith community leaders to come to the table to have this discussion, to bring these programs, this health information and these wonderful programs to their congregation, to their communities. And when you talk about sharing resources, sharing information, many times the solution is not always to write a check. The solution may be you have a piece of the solution, I have a piece, we put our pieces together, we find, we have a solution. So that's one of the things that you're going to find is the through line throughout this entire docuseries is that no matter where you are in the state, how much money you have, how much access to resources you have, you may have a piece of the puzzle. If you bring your piece to the table, we can put something together. And I want to make sure and state this too, because I'm not sure if Jack even realized this, that this is going to be a powerful presentation. You absolutely want to see it in its entirety tonight. But this docuseries is also meant to be a tool where each segment will be broken down. Kenesha is leading the development of a discussion guide for communities themselves. To take the pieces of the docuseries, break it down, and they can come up with an action plan at the community level. So that takes time. So we're not talking about something that'll happen next week, but it is meant to be a tool. So Jack, I commend you not only on the quality of your piece, but to let you know this will be an educational piece and a community change agent for quite a long time.
Yeah, I love that. That's great. And that's what people need. They need resources. They need they need help in helping themselves. We need help to help ourselves.
Right. Yeah.
And I love that DAC is involved in that process, spearheading that process. And as Kenesha, both you and Michelle have said, there's room at the table for people to come and be involved, be engaged, and give their input. Because so many times I think we see organizations and we don't think we are represented. People are represented.
Very important. Very important. And I mean, that's something else. It is important, regardless of what you say. I'm trying so hard not to have this. There we go. It is so important for people to see themselves in the solution.
Yeah.
And the messenger is so important. Jack can definitely tell you a lot of times it is who's bringing you the message.
Absolutely.
It's not even just the information. It's also who's bringing it to you.
Yeah. Yeah. And that, and then the other thing is where that the people that are actually experiencing the issues are at the table, because these people can tell you firsthand experience, not doctors, lawyers, and Indian chiefs, but people that are in Earhart and have diabetes and are dealing with all of the different things, the food desert, the pharmacy deserts, so that they can explain to you what's going on.
And I'll tell you what too, to jump in there, to your point, Trey, many times leaders, business leaders, community leaders, political leaders think, oh, we've got the solution. and they present it out, and then they wonder why it's not working, why it's not resonating.
Right,
So
right.
like you say, if the person who is the receiver is the one that's telling you whether or not you have a message that's working. So you have to have them as part of that feedback loop.
That's a big one.
Otherwise, you're just putting stuff out there and it's falling on deaf ears.
Yeah. The docuseries airs tonight at 6:30. You can watch it on the In It Together Facebook page and on their YouTube channel. You can see the information there. It's tonight at 6:30. Just one of many things, the docuseries and also the comprehensive plan, just two of the many things that DAC is doing to really combat diabetes in our state and have it be diabetes free in just a couple of years. Another thing before we leave, ladies and gentlemen, I want to mention as we went into the break, the Kimberly Aiken piece, and this is the Faces campaign. Can one of you tell us about the Faces campaign?
I almost did a happy clap. I was so let me jump in there on that one, Kenesha, because we had an opportunity to work with Kimberly Aiken. Because if any of you who know her background, not only was she Miss America in 1994 and a South Carolina native, but her family works in healthcare and has for a long time. And so she had a very vested interest in being a part of this project. So she was engaged to be to narrate the docuseries. So you are going to see her participating in the docuseries. Well, when we started talking about the Faces of Health, which is just taking notable South Carolinians, people whose faces would get your attention, giving them an opportunity to speak about the message of prediabetes, which again is a thing, and diabetes, and get them to kind of get you to go to the inittogethersc.org website to take that prediabetes risk assessment. You guys are putting that up there, which is just a simple test to find out if you're at risk of prediabetes, and just being able to get some notable faces talking about this issue and bringing it to the forefront. And I could not begin to tell you, Kimberly was a joy to work with, and she was very serious about her commitment to health and being a part of this whole project.
Yeah. So the Faces campaign has already launched. She's doing a series of PSAs. As you said, she is also narrating the docuseries. And then what, Michelle? There will be other faces that are debuted throughout the year?
Correct. We're pushing on, several years at a time. So we're working through finding other notable faces and people who can come and tell a piece of the story. And we want people, in fact, we're taking suggestions. I keep throwing Kenesha out there. Get in touch with Kenesha and her contact information and let her know, who are some of the people that you would like to see? Who are some of the people? Now, what's interesting too is regardless of how famous the face is, everybody has a story and a connection. So we find a lot of people who you may not have known had the diabetes or prediabetes touch their families and very willing to be a part of this campaign.
Yeah. If you want more information about the Diabetes Action Council or about participating in the Action Council or about the Faces, as Michelle said, you can contact Kenesha Golden Smith. She is with the Diabetes Action Council. Her information is on the screen. So please reach out to her. And don't forget tonight at 6:30, the docuseries launches. You can watch it from your phone. You can watch it from your tablet, watch it from your computer, because it is accessible on PC, Mac, iPhone, iPad, Android device through the In It Together Facebook page or YouTube. Michelle, thank you so much for joining us today. Kenesha, thank you so much for the work that you're doing with the Diabetes Action Council. And Jack, thank you so much for lending your expert, award-winning storytelling skills and expertise to this project, and for bringing your sensitivity even today to let people know that, like you said, there's just some things we just don't know. We just are not aware of, but we need to be conscientious about so that we can affect a change for everyone in our lives. So thank you all so much.
It's important for us to remember, guys, that that a lot of this is within personal control, and some of it is a condition that is not within their control. But people can do things to help themselves, even if they can't find a doctor nearby or a pharmacy nearby or have a supply of fresh food. They do have the ability to modify their own behavior, and they can take some control of this difficult condition and make their own lives better.
Yeah, absolutely.
And they don't have to do it alone.
And they
We're
don't
together.
have to do it alone. Yeah, and that's the thing about it, Jack. I agree. You know, we have to take charge of our own health. We have to be responsible. Sometimes we need a little bit of help to do that, you know, because listen, if you've been like you said, you know, the man that was there eating a bucket of chicken and peanut butter, and he was probably washing it down with a Diet Coke, you know, he's probably been doing that all of his life. So he, you know, that those habits are just hard to break. But listen, you don't have to do it alone. That's the good thing about it. Help is not on the way. Help is here, and help is in the form of the Diabetes Action Council. Jack, thank you so much for joining us. So great seeing you.
Sure.
Congratulations on your work with the Buckley School of Communications, of Public Speaking, helping people to learn how to be more comfortable public speaking, because that's a fear for a lot of people. So I'd love to get you back on to kind of talk about that and some other things that you're doing. We miss you on the air, but so glad that you are utilizing your God-given talents in other ways too. So thank you again. Michelle, thank you so much. Michelle Harris with DHEC and Kanisha Golden-Smith with DAC. Don't forget, tonight at 6:30 is the launch of the Docuseries. You know someone that needs to see this. You need to see this. So please don't forget to post and share the link for people to see this Docuseries tonight. Thank you all so much for joining us today. I appreciate you.
Thank you, Trey.
Thanks.
Yeah. In It Together, SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. I'm Trey Taylor. Thank you again so much for joining us. Listen, if you have a story or initiative that can help someone cope with COVID, please email booking@copingwithtreytaylor.com. Booking@copingwithtreytaylor.com. That information is scrolling at the bottom of the screen. If you have a product or service that can help someone cope with COVID, please email copingwithtreytaylor@gmail.com. Copingwithtreytaylor@gmail.com. We would love for you to be a proud sponsor of Coping with COVID, just like In It Together SC and the Diabetes Action Council. Also, the City of Columbia Office of Business Opportunities, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson, Palmetto Media Connections, Agape Counseling and Training Services, Black Expo, the Comet Bus System, Palmetto Painting Services, and Computers Unique Dutch Square Mall. Tomorrow, we're actually going to talk to Solicitor Byron Gibson. He'll discuss the gun violence town hall meeting that was held last week. If you remember, we aired that. That town hall meeting. He'll talk about his takeaways and next steps. Plus, the next warrant resolution court date has been set. We'll tell you about that also tomorrow on Coping with COVID. And then we'll talk to Coach Ebb. She's going to show us just in time for the foodiest season of the year how to get and stay fit and fabulous inside and out. That's tomorrow on Coping with COVID. Friday, it's Adoption Awareness Month. We'll talk to Will Batchelor and Colleen Ragley with DSS about the adoption process. And then we'll talk to some families who have adopted children and some children who have been adopted. That's Friday on Coping with COVID. As usual, I leave you with a reading from Jesus Calling. Today, on this November 17th, Jesus says to walk along the path of freedom, you must keep your mind firmly fixed on me. Jesus says many voices proclaim this is the way for you to go, but only my voice tells you the true way. If you follow the way of the world with all of its glitter and glamour, you'll descend deeper into an abyss. Christian voices can also lead you astray. Do this, do that, pray this way, pray that way. Don't pray that way. If you listen to those voices, you'll become increasingly confused. Be content to be simple sheep, listening to my voice and following me. Jesus says, I will lead you to restful green pastures and guide you along the path of righteousness. That's your Jesus Calling for today, Wednesday, November 17th. I'm Trey Taylor. Until the next time, I wish you peace, abundant blessings, stay safe, be well, get your vaccine, please. And don't forget, you still need to wear your mask over your nose and under your chin. I'll see you tomorrow.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with